Gluteal muscle strength becomes increasingly important after age 60 for maintaining mobility, preventing falls, and supporting daily activities. The gluteal muscles, particularly gluteus maximus and gluteus medius, are essential for walking, standing, balance, and protecting lower back and knees. Today we're covering 3 foundational glute exercises specifically designed for older adults: side-lying leg raises, glute bridges, and standing hip extensions. These exercises are low impact, accessible, and highly effective when practiced consistently. Before we begin, this is educational content, not medical advice. Always consult your healthcare provider before starting new exercises, especially if you have hip problems, recent surgery, balance disorders, or other health conditions. Understanding gluteal muscle importance: the gluteal muscles consist of 3 main muscles: gluteus maximus, the largest muscle powering hip extension and standing; gluteus medius, crucial for hip stability and balance; and gluteus minimus, supporting hip abduction and rotation. After 60, these muscles often weaken due to prolonged sitting, reduced physical activity, age-related muscle loss, and decreased challenging movement. Weak glutes contribute to balance problems and fall risk, lower back and knee pain, altered walking patterns, and difficulty with daily activities like stair climbing and standing from seated. However, research consistently shows that appropriate strengthening exercises can significantly improve gluteal strength at any age, supporting better mobility and independence. Exercise 1: Side-lying leg raises for hip stability. The first exercise is side-lying leg raises, strengthening gluteus medius and hip abductors. These muscles stabilize pelvis during walking, prevent sideways falls, and support proper knee alignment. Here's how to perform side-lying leg raises safely. Lie on your right side on mat or carpet. Stack legs with both relatively straight. Rest head on right arm or use small pillow for comfort. Place left hand on floor in front of chest for stability. Keep hips stacked vertically, not rolling forward or back. Slowly lift top, left, leg upward approximately 8 to 12 inches. Keep leg relatively straight with foot flexed. Maintain stable torso, don't roll hips. Pause briefly at top position, feeling outer hip muscles engage. Slowly lower leg back down with control. That completes 1 repetition. Perform 10 to 12 repetitions on left leg. Roll over and repeat on right side. Start with 1 set per side. Progress to 2 sets as strength improves. Important form reminders: lift comes from hip, not from rolling torso. Keep movement controlled and deliberate, no swinging. Height of lift matters less than control and proper form. Breathe naturally throughout movement. Rest as needed between sets. Modifications: for comfort, place small pillow between knees when starting. For limited hip mobility, reduce lift height significantly. Even small movements provide benefits. For support, perform exercise with back against wall for stability. If lying on side is uncomfortable, perform standing version holding support. What to realistically expect: with regular practice 2 to 3 times per week over 6 to 10 weeks, you may notice improved hip stability during walking, better balance during single-leg activities, reduced sideways sway, and enhanced confidence during movement. Gluteus medius strength is crucial for fall prevention and safe walking. Exercise 2: Glute bridges for posterior chain strength. The second exercise is glute bridges, strengthening gluteus maximus, hamstrings, and supporting lower back stability. Strong posterior chain muscles support standing from seated, walking power, and spinal protection. Here's how to perform glute bridges safely. Lie on back on mat or carpet. Bend knees with feet flat on floor, hip width apart. Position feet so knees are approximately over ankles when hips lift. Let arms rest by sides, palms down. Keep head and shoulders relaxed on floor. Press through heels and lift hips toward ceiling. Lift until body forms relatively straight line from knees through hips to shoulders. Don't arch lower back excessively at top. Squeeze glutes at top position. Hold for 2 to 3 seconds. Slowly lower hips back down with control. That completes 1 repetition. Start with 10 repetitions. Rest briefly. Complete 1 to 2 sets initially. Progress to 3 sets of 12 to 15 repetitions as strength improves. Critical technique points: movement comes from glutes, not from pushing with lower back. Keep core gently engaged throughout. Press through heels, not toes. Maintain neutral neck position, don't tuck chin. Breathe naturally, exhale during lift, inhale during lower. Modifications: for limited range, lift hips only partially, even small lifts provide benefits. Place small pillow or rolled towel between knees and gently squeeze during lift for additional inner thigh engagement. For progression, hold top position longer, 5 to 10 seconds. If cleared by healthcare provider, place light weight like pillow on hips for added resistance. What to realistically expect: with regular practice 2 to 3 times per week over 6 to 10 weeks, you may notice easier standing from seated positions, reduced lower back discomfort for some individuals, improved walking power and stair climbing, and enhanced posterior chain strength. Glute bridges build fundamental strength for daily activities. Exercise 3. Standing hip extensions for functional strength. The third exercise is standing hip extensions, strengthening gluteus maximus and hamstrings while practicing functional movement pattern. This exercise mimics natural walking motion and supports daily activities. Here's how to perform standing hip extensions safely. Stand facing sturdy chair, counter, or wall for support. Hold support with both hands at comfortable height. Stand with feet hip-width apart. Shift weight onto left leg with knee slightly bent. Keep right leg relatively straight. Slowly extend right leg backward 6 to 12 inches. Keep torso upright, don't lean forward. Maintain stable pelvis, avoid arching lower back. Pause briefly at back position, feeling glute engage. Slowly bring leg forward to starting position with control. That completes 1 repetition. Perform 10 to 12 repetitions with right leg. Switch to left leg and repeat. Start with 1 set per leg. Progress to 2 to 3 sets as strength improves. Important form points: movement comes from hip extension, not back arch. Keep standing leg stable with soft knee. Maintain upright torso throughout. Extend leg only to range where back stays neutral. Focus on glute engagement, not leg height. Breathe naturally throughout. Modifications: reduce backward leg movement if you feel lower back strain. Hold support with both hands continuously for balance. For progression, hold extended position longer, 3 to 5 seconds. Once confident and cleared by healthcare provider, try using light ankle weight, 1 to 2 pounds. What to realistically expect: with regular practice 2 to 3 times per week over 6 to 10 weeks, you may notice improved walking mechanics, stronger hip extension for stairs and standing, better balance during daily movements, and enhanced functional lower body strength. Standing hip extensions train movement patterns used constantly during daily activities. Creating comprehensive glute strengthening routine. Here's how to integrate these exercises into effective routine. Practice all 3 exercises in sequence 2 to 3 times per week. Sample routine: side-lying leg raises, 1 to 2 sets of 10 to 12 reps per side. Rest 60 seconds. Glute bridges, 2 to 3 sets of 10 to 12 repetitions. Rest 60 seconds. Standing hip extensions, 1 to 2 sets of 10 to 12 reps per leg. Complete routine takes 15 to 20 minutes. Allow at least 1 rest day between glute strengthening sessions for muscle recovery. These exercises can be performed together or split throughout day as convenient. Progression principles for glute exercises: progress gradually using these principles. Start with suggested repetitions and sets. Once comfortable, increase repetitions before adding sets. First reach 12 to 15 repetitions comfortably, then add additional set. Once multiple sets feel manageable, consider progressions like longer holds, light resistance, or reduced support. Always prioritize proper form over quantity. Poor form with high repetitions provides less benefit and higher injury risk. Listen to your body and progress at appropriate pace for you. Some individuals progress quickly while others need more time. Both paths are valuable when consistent practice is maintained. Essential safety considerations: these glute exercises are generally safe but require appropriate caution. Stop any exercise causing sharp pain, joint pain beyond mild muscle fatigue, lower back pain during or after exercises, or significant increased discomfort. You should consult healthcare provider before beginning if you have recent hip, knee, or back surgery within past 6 months, severe arthritis with constant pain, herniated discs or significant back problems, uncontrolled cardiovascular conditions, or balance disorders making standing exercises unsafe. Always use sturdy support for standing exercises. Practice on non-slip surface. Keep exercise area clear of obstacles. Start conservatively and progress gradually. These exercises work best combined with regular walking as tolerated, proper nutrition supporting muscle health, adequate rest and recovery, and other healthy lifestyle practices. Realistic expectations for glute strength: gluteal strength improvements occur gradually with consistent practice. Weeks 1 to 4, learning proper form and technique, initial muscle soreness which is normal, beginning to establish routine, some may notice slightly improved hip stability. Weeks 4 to 8, exercises feeling more natural and controlled, noticeable improvements in glute strength, ability to progress repetitions or add sets, improved ease during daily activities requiring glute strength. Months 3 to 6, clear improvements in functional strength for walking and stairs, better balance and stability, established sustainable routine with continued progress, enhanced confidence in physical capabilities. The goal is gradual sustainable improvement supporting long-term mobility and independence, not rapid transformation. Monitoring functional improvements: track progress through real-world functional improvements rather than just exercise numbers. Notice if you can stand from chairs more easily without arm assistance, walk with better stride and power, climb stairs with less difficulty, maintain better balance during daily movements, and feel more stable and confident overall. These functional improvements indicate meaningful strength gains supporting independence and quality of life. Integration into daily life: consider integrating glute awareness into daily activities. When standing from seated, consciously engage glutes. During walking, focus on proper hip extension using glutes. While standing at counter or sink, practice gentle glute squeezes. This integration reinforces strengthening work and maintains awareness of these important muscles throughout day. Complementary practices: glute strengthening works best combined with regular walking, maintaining cardiovascular health and functional mobility, flexibility work for hips and lower body, balance exercises supporting fall prevention, and core strengthening supporting overall stability. Comprehensive approach addressing multiple aspects of fitness provides best overall results for maintaining mobility and independence. Conclusion: these 3 glute exercises, side-lying leg raises, glute bridges, and standing hip extensions, provide comprehensive gluteal strengthening supporting essential functions for mobility and independence. Side-lying leg raises strengthen hip stabilizers crucial for balance. Glute bridges build posterior chain strength for standing and walking. Standing hip extensions train functional movement patterns for daily activities. Start at appropriate levels using all suggested modifications. Practice 2 to 3 times per week consistently. Progress gradually based on how your body responds. Use proper support for safety always. Listen to your body and stay within comfortable ranges. Combined with regular walking and healthy lifestyle practices, these glute exercises can significantly improve strength, balance, and functional capacity supporting continued independence and quality of life. Thank you for watching. For specific concerns about appropriate glute exercises for your situation, consult with a physical therapist or healthcare provider for personalized guidance. Subscribe for evidence-based information on strength training and functional fitness for older adults, practical guidance prioritizing safety while helping you maintain mobility and independence through targeted strengthening.